Hello everyone. So today we'll be starting with a new chapter, that is your GI pathology. All right, and we'll be starting with your stomach first. So let's look at the parts of your stomach. All right, so we see your esophagus here. All right, so this is where your stomach starts from. All right, right. So what do we see here? The first part is your cardia, then we see your fundus, we see the body, we see the pyloric antrum, we see your pyloric canal here. All right, so that was your stomach. Now there's a lesser curvature here, and then there's your greater curvature here. All right, so if one were to define your stomach, how would one define it as? So it is a J-shaped, hollow, muscular organ. All right, and its main function is to store your food. All right, now coming to the pathology, we'll be starting with your gastric carcinoma. All right, now this condition, your gastric carcinoma, is 2 times more common in men. All right, and your carcinoma of stomach comprises of more than 90% of the gastric carcinomas. All right, now let's come to the etiological factors. All right, the causes that will lead to your gastric carcinoma. So the first one is your H. pylori infection. So it has been seen that people with gastric carcinoma most usually associated with your H. pylori infection. All right. Second are certain dietary factors. All right. So let's see what are these dietary factors. Number one being your tobacco. All right. It could be either in the form of your tobacco smoke or tobacco juice. Then there's your alcohol consumption. All right. Thirdly, people that consume high salt. All right. Ingestion of your smoked foods. Then there's your pickled raw veggies. Yeah. And then there's your nitrates in food. All right. Now let's look at certain geography factors. Yeah. So it has been seen that that Japanese and people from Chile and Italy, so these three regions have a higher risk of gastric carcinoma. All right. Now let's look at race. All right. So there are your blacks and your Native Americans. Now it has also been seen that certain genetic factors also do have a role in a gastric carcinoma. The last etiological factor we'll be discussing are certain pre-malignant changes that are seen in the gastric mucosa, which lead to gastric carcinoma. All right. So let's see what are these pre-malignant changes. All right. So there's a mnemonic for this, that is your PUSA. All right. P stands for your adenomatous polyps of your stomach. All right. U is for your chronic gastric ulcers. Yeah. And S is for your strump carcinoma, and A is for alcohydria. Yeah, so now that we're done with the etiological factors, let's jump to the classification of a gastric carcinoma. All right, so your gastric carcinoma can be classified based on two types. All right, the first type being your based on invasion. Yes, and the second classification is your conventional classification. Yeah. So based on invasion includes two groups. Yeah. The first being could be either your expanding type, that is your tumor could be expanding, or the tumor could be infiltrating. All right. Now conventional classification. This is what we are concerned with. So this includes two groups. The first being your early gastric carcinoma. All right. And the second being your advanced gastric carcinoma. Now, this advanced gastric carcinoma includes 5 subtypes. Yes, so let's discuss these 5 subtypes first. So, the 5 subtypes and their respective microscopic patterns. Yes, the first one is your ulcerative carcinoma, which has a microscopic pattern of your tubular adenocarcinoma. Yes, the second being your fungative or polyploid carcinoma, which has a microscopic pattern of your papillary adenocarcinoma. The third subtype is your serous carcinoma, which is also known as linitis plasticia. Yes, which has a microscopic pattern of signet ring cells. Yes, and the fourth subtype is your colloid or mucoid carcinoma, which has a microscopic pattern of mucinous adenocarcinoma. And the last subtype is your ulcer cancer, which has a microscopic pattern of your adenocarcinoma. Alright, so now let's study the morphology of your different gastric carcinomas. Yeah, so we'll be starting with your early gastric carcinoma. Alright, so this is a term that is used to describe cancer limited to the mucosa and your submucosa. All right, so when the tumor is limited to your mucosa and submucosa, it is known as your early gastric carcinoma. Yes, so now let's come to its gross features. Yes, we see that your early gastric carcinoma can be of your 3 types. This is your type 1, there's your type 2, and your type 3. Yes, type 1 is also known as your polyploid type, whereas your type 2 has 3 subtypes. Yes, type 2A, type 2B, and type 2C. Type 2A is your superficial elevated, type 2B is your superficial flat, and your type 2C is your superficial depressed. Yes, and your type 3 is your ulcerated type. So this is how your type 1 looks, right? Yeah, your polyploid type. So we see the mucosa here, we see the submucosa here, we see the muscularis propria and the serosa. So as you can see, the tumor, yes, it is of polyploid type, and it is also confined to the mucosa and submucosa. Yeah, which is what makes it your early gastric carcinoma. Coming to your type 2A, which is your superficial elevated, we see the tumor here. We see that it is superficially elevated. Yes, so thus having the name superficially elevated. Coming to your type 2B, we see superficial flat. Yes, we see that it is flat. Yes, it is aligning with the layer of your mucosa. Yeah, coming to the third type, that is your type 2C. Yes, it's superficially depressed. So this is depressed. Yeah, it is in the mucosal layer, also the submucosal, but it is superficially depressed. Coming to the last type, that is your type 3 ulcerated type, we see it is in the form of certain ulcers here. Yes, so those were the cross. So we see here that the tumor is located in the region of your pyloric canal. Yes, and your early gastric carcinoma is a typical example of your glandular adenocarcinoma. Alright, so what do we see here? We see your well differentiated adenocarcinoma. Alright, and we see your muscularis is uninvolved. Now let's come to your advanced gastric carcinoma. So when does this occur? So what happens is, pathologically speaking, your early gastric carcinoma, alright, eventually penetrates your muscularis layer, alright, and crosses and turns into your advanced gastric carcinoma, alright. Now we studied that your advanced gastric carcinoma was of 5 subtypes. So let's start with the first subtype, which was your ulcerative carcinoma. Yeah, we also read that this was a microscopic pattern of your tubular adenocarcinoma. Yes, so this is the most common pattern of your advanced gastric carcinoma. Yeah, now let's come to its gross features. Alright, so these are the gross features. The tumor is flat, yes, it is infiltrating, it has an ulcerative growth, yeah, and your irregular necrotic base. We also see that its location is of your gastric canal. Yes, now let's come to its microscopic features. Yeah, what do we see? We see that there's a tubular pattern here. Yes, and we also see that your adenocarcinoma is poorly differentiated. Yeah, so these were the features of your ulcerative carcinoma. So the second subtype is your fungating or polyploid subtype. Yeah, now this is a second most common pattern. All right, this has a cauliflower like growth appearance, all right, which projects into the lumen. Yes, and thirdly, the location of this tumor is usually in your fundus. All right, as you can see here, the tumor is in your fundus. Yeah, now the fourth point is that this tumor usually undergoes necrosis, leading to infections. All right, so that was done, and now let's look at the microscopic features of this. Yeah, we see your well differentiated adenocarcinoma, and we see your papillary pattern here. Yeah, all right, so the third subtype is your Lenitis plasticia, which is also known as your Schirr's carcinoma. Yeah, and this has a microscopic pattern of your signet ring cells. Yes, so what happens in this condition is that there is extensive desmoplasia, all right, which leads to thickening of the stomach wall. Yeah, which leads to fibrosis. All right, and eventually gives an appearance of your leather bottle. So you would have seen this in old Disney TV shows Aladdin, that the people of Arabia would carry a leather bottle, yeah, which would have water. So that's how the stomach wall resembles in this condition, serous carcinoma. Yeah, so the tumor can have two locations, all right, depending on if it is the tumor is localized or diffused. So if the tumor is localized, it is found in your pyloric antrum, yeah, whereas if the tumor is diffused, it affects the whole of stomach, that is from cardia to your pylorus. All right, so now let's look at the gross and microscopic features. What do we see here? We see here that we see that the lumen is reduced because of the tumor taking up so much of the space. Yeah, because the tumor has taken up so much of the space in these areas, the size of the lumen here has reduced. All right, so now let's come to the microscopic pattern. We see signet ring cells. Yeah, these are your signet ring cells, thus giving it the name signet ring cell carcinoma. All right, now let's come to the last subtype, that is your ulcer cancer, and this has a microscopic pattern of your adenocarcinoma. Yeah, so these are your malignant lesions. Yes, and they develop from your chronic gastritis. Yes, these are also very rare conditions. And now let's come to the features. All right, so your gastric ulcer can either be benign or malignant. Yes, now let's discuss this under these headings: age, sex, duration of the symptoms, their location, gross features, yeah, such as the size, shape, mucosal fold, ulcer bed. All right, and their barium studies, the acidity levels, and the treatment. All right, so age. Now benign is usually seen in young individuals, whereas malignant is seen in your older individuals. Sex, this is more common in your male. This is seen only in males. The duration of symptoms, this lasts for about weeks to years. This is weeks to months. All right, the location for your benign is your lesser curvature, and for your malignant is your greater curvature. Yeah, now let's come to the gross features. The size, your benign is small, malignant is large, shape has a regular shape, and your malignant has an irregular shape. Yeah, the mucosal folds. So the ulcer bed in your benign is hemorrhagic, whereas in your malignant is necrotic. All right, barium studies for your benign gastric ulcer show punched out ulcers. All right, and for your malignant ulcers show an irregular filling defect. All right, the acidity for your benign is normal to low, whereas for your malignant is normal to alchorrhea. Yeah, and the response to treatment for benign is well, whereas for your malignant is no response. Yeah, it does not respond to treatment. Now let's come to their morphological features. We see that This is the tumor in the ulcer. All right. And in coming to the histological features, we see ulcers here. Yes. And we also see a microscopic pattern. Now let's study the spread of your gastric carcinoma. All right. How does your carcinoma of your stomach spread? So it can spread via three routes. All right. So the first could be your hematogenous spread. That is via your blood. All right. So this may occur in conditions of your liver, lung, all right, your brain, bones, kidney, and your adrenal glands. All right. The other route could be your lymphatic. All right. Now, metastasis to the regional lymph nodes occurs early. Yeah. So this is seen especially in your serous carcinoma. Yeah. Second group of lymph nodes that are involved are usually present along your lesser curvature and your greater curvature. So these two groups of lymph nodes are usually involved. All right. Now, the third heading we'll be discussing under the lymphatic spread is your due to involvement of your left supraclavicle lymph node, we see your Virchow's sign. Yes. So now let's study the most important route by which a gastric carcinoma can spread. That is your direct spread. All right. So this is the most common feature of your gastric carcinoma. All right. Now this happens mainly due to your loose submucosal layer. Yeah, due to which the tumor starts invading your muscularis and serosa and eventually goes upwards or downwards. So I'm going to explain this by the help of this diagram. Yeah. So this is your mucosa, this is your submucosa, this is your muscularis propria, and this is your serosa. So this was an individual's tumor. Yeah. So it could either go up eventually to the esophagus, all right, or it could go downward. Yeah. So it starts invading downward and enters the peritoneal cavity. All right. And then your transcolon. Yeah. And then occurs your transcoelomic dissemination. All right. And the tumor keeps going downward. It could also give rise to your Krukenberg's tumor. Yeah, if the tumor reaches your ovary. Yes. So this direct spread may affect these organs. All right. The organs in the nearby locations such as your liver, your omentum, could be the greater omentum or your lesser omentum. All right. Third is your pancreas, fourth is your spleen, and fifth is your transverse colon. Yeah, so that was your spread of gastric carcinoma. Now we'll be coming to the last topic of gastric carcinoma, that is your clinical features for your gastric carcinoma. So the first one being obviously your abdominal pain. The patient complains of severe abdominal pain. All right, and you see there's a loss of weight in the patient. He loses a tremendous amount of weight. All right, there is also loss of appetite. Yes, and there is constant vomiting associated with your diarrhea in the patient. All right, the most common complication of your gastric carcinoma is hemorrhage. All right, so we've covered almost all topics. So we saw the parts of stomach, we saw the classification of a gastric carcinoma, we read the etiological factors, we studied the different types of gastric carcinoma. We started with your early gastric carcinoma, then we went to your advanced gastric carcinoma. We read about the 5 subtypes, and then we also studied about the spread, how your gastric carcinoma can spread, and then we ended with the clinical features of a gastric carcinoma.